evening. I'm Mike Cavanaugh, and this is another edition of Cavanaugh's Corner. Tonight, our show is going to be focusing on workers' health and safety in honor of Workers' Memorial Day, today, April 28th. In a couple minutes, we'll be looking at a videotape produced by the California group We Do the Work, a tape dealing with health and safety issues that working people throughout our country are facing today. After the tape, I'll be joined by Ned McCann of the Maine AFL-CIO and Vinny O'Malley from the Maine Labor Group on Health for a discussion about Workers' Memorial Day and health and safety here in the state of Maine. Right now, let's watch the video, Working Until It Hurts by We Do the Work.
The workplace used to be rife with hazards. Heavy machinery, flying sparks, toxic chemicals, dangerous heights, and specialized tools. For many workers, those dangers appear to be long gone. But the sleek appearance of modern offices can be deceptive. As a new generation of workers is discovering, these seemingly safe environments can be every bit as dangerous.
It comes in the middle of the night. I'm dead asleep. It wakes me up. I feel like somebody stabbed me in the hand with an ice pick. And I go, what was I doing at that moment to cause the pain? So do you think at that moment, well, gee, maybe it was because I was typing on a keyboard 8 hours ago? No, you don't think about that.
I guess you never realize how much you use your hands and your wrists until you can't use them.
I mean, at 32 years old, to think that I'm 21% permanently disabled in my hands is not a real thrilling thought. I may eventually have to find a job where I didn't use my hands. And I've yet to figure out where there's a job that you don't use your hands.
It isn't just our industry. It's everywhere. It's because all of this equipment that's been developed in order to help you get your work done quicker, to speed up production, it wasn't built to accommodate the limitations of the human hand.
Since 1985, injuries resulting from the use of computers and other rapid motion equipment have been the fastest growing category of occupational illness in the United States. These injuries are known by a lot of different names. Repetitive strain injuries, repetitive motion illness, carpal tunnel syndrome, CTDs, but all of them are basically the same thing. Microscopic injuries in the muscles and tendons, usually in the hands, wrists, arms, neck, or shoulders, caused by constantly repeating a single motion thousands of times during a workday. Though repetitive injuries are starting to be recognized as a serious hazard, there's still an enormous amount of resistance from employers reluctant to acknowledge the extent of the problem. In this program, you'll hear stories from some of the victims of this epidemic and find out what workplace advocates are trying to do about it. A huge proportion of repetitive injuries, commonly known as RSI, occur among people who work at computer keyboards, but they can also result from using other equipment, from glass-cutting tools to pneumatic drills. All it takes is a constant, incredibly fast repetition of a single small motion, without taking enough breaks so the body can rest. The symptoms usually start with soreness, aching, numbness, or tingling. In severe cases, they can result in complete loss of function and permanent tissue damage. Meat cutters get RSI. Musicians get it. Calligraphers, court reporters, flight attendants, wine stewards, garment workers, shelf stockers, all are seeing RSI rates skyrocket. But these injuries, debilitating, painful, often career-threatening, and sometimes incurable, are particularly common among several groups: grocery clerks, newspaper reporters, and telephone operators.
You're very welcome. Bye-bye.
Hi, this is your AT&T operator. May I help you? We are on a VDT computer where we sit all day and call after call comes in and we look up numbers on a computer. And on an average day, you can handle between, on a good day, probably about 1,300 calls
Becky Hogue is 32. Since 1989, she suffered from a chronic case of tendinitis in her hands and arms, caused by spending 8 hours a day working on a computer keyboard. According to union officials, it's a problem that's reached epidemic proportions among communications workers.
We just did a study, nationwide study, and we found a catastrophic rate. As much as 75% of these people recognizing symptoms that were affecting their health.
Well, as soon as my hand started bothering me, I notified my manager, and I said, you know, it's because of the job. She took all the information down, and that started my 3.5-year progress of trying to get them to admit that it was work-related.
In addition to dealing with the pain caused by her injury, Becky worries about her family's financial future, since she's the sole provider for herself and her mother. Routine activities are extremely difficult for her, and they will cause her problems for the rest of her life.
I had a person in Stockton say to me that the people in her office knew it was a bad day for her hands when she came to work with her hair wet because she couldn't hold her blow dryer. And I mean, things like that you normally don't think of as heavy, on a bad day are real heavy. There are days when by the end of the day I want to be in tears because my hands hurt so bad.
Although Pacific Bell, Becky's employer, has produced safety videos and a pamphlet about RSI, the company continues to deny in many workers' compensation cases that RSI is caused by keyboard work.
And what we're seeing is the company is now weighing the cost of workers' comp on the one hand and the cost of preventing injuries, and they're choosing on the side of fighting workers' comp cases.
I don't know. I think it's a more complicated issue than just saying that carpal tunnel syndrome is associated with the workplace. It's becoming more modern to be associated with the workplace. There is a certain amount of repetition, especially if you're doing keyboard stuff.
Their initial reaction is confrontation, that it's your lifestyle, that it's your, it's you knit at night, it's whatever it happens to be.
Well, I did have one manager, and I'll always remember this. She said, well, if your hands completely go, you do have 10 toes that you can still operate with.
Denying that the problem exists can be particularly devastating, because in almost all RSI cases, the key to full recovery is rest and early treatment.
Now would be wrist flexion.
In 1990, not long after Becky was injured, skyrocketing rates of RSI among office workers prompted legislators in San Francisco to pass an ordinance regulating the use of computers.
It would have provided for ergonomic workstations, adjustable chair, adjustable furniture, emphasis on training for workers to bring up the awareness around what's causing these injuries, what's causing the pain in your back, your neck, your wrists when you go home at night.
There are some standards, at least in the original draft, that would make it almost impossible to continue to employ people where you had to comply with the standards because of things like this, communicating with all employees about all hazards, known or suspected to be associated with VDTs.
The resistance we got from it was absolutely incredible. They flew people in here from all around the country to resist our VDT ordinance. All Pacific Bell, AT&T, Bank of America, Wells Fargo, IBM, you name it, Bechtel Industries, they were all here.
And the San Francisco ordinance was written so that you would do a lot of things, and some of them were very protective, but ridiculous. Every CRT, cathode ray tube, had to be at least 5 feet or 5 meters from every other one. That in itself would have cost us to have to double our leased and owned floor space in San Francisco because somebody was worried about it.
Before the ordinance was passed, many of the provisions the business community objected to, including the demand that visual display terminals be separated by a minimum distance, were deleted from the final draft.
We were able to prove that not only would it not be all that expensive, $349 is what we estimated it would cost a non-complying workstation to become complying. But it would also improve productivity and reduce workers' compensation. Now that's an improvement in how you do business.
Immediately after the ordinance passed, a lawsuit against it was filed by two San Francisco businesses with financial help from the computer giant IBM. A year later, a judge declared the ordinance invalid, ruling that local legislators didn't have the power to set workplace safety standards for private employers.
I'm glad I wasn't in the courtroom that day. I got into a discussion with someone right after it, and I said, well, you know, that's basically, they're saying it's okay to hurt people. You know, it's not serious enough to care enough to have this ordinance. Let's just toss it out the window. It's okay if you hurt somebody.
Every employer wants to maximize productivity, but companies now agree that productivity is only a part of the picture.
Pacific Bell insists that even without the ordinance, it will continue to educate workers and update its workstations. Employees like Becky, however, say they haven't seen much evidence of that. And according to the union, the company continues to contest injury claims and to discipline or fire employees who insist on being compensated. Becky is one of the lucky ones. In 1992, her case came before a workers' compensation judge who ruled that Pacific Bell was indeed responsible for her injury.
It got me a sum of money. They agreed to pay my medical bills on my hands, basically forever. But that doesn't give me the use of my hands back.
Among the many workers at risk for RSI are those who spend their days working on another kind of fast-paced equipment, the scanners you see in your local supermarket.
I started having a problem around the beginning of 1991. I started noticing that after work, working with my wrists all day and carrying and working on the scanners, I was leaving work with a lot of aching in my wrists. You're using the scanners constantly with your wrist and turning your wrist back and forth, up and down like this, and doing that at 6-hour intervals, and some people do it for 8 hours at a time.
Can you imagine, grab a gallon of milk, and you've got to pull it, and you've got to lean it a little bit. The scans are supposed to work where you just can pull it straight across, but they don't. Then you got to pull it back over there, and you've got to do it again. And you keep doing this all day long.
Anita Bowens and Jean Picciano work as supermarket checkers in Los Angeles. Both have spent the last couple of years struggling with severe cases of RSI in another industry that's been reluctant to acknowledge the problem.
The manager has a record he needs to keep for the whole year for keeping injuries down in the store level. And in July, that was going to have an effect on his bottom line at the end of the year. So he wasn't very happy about it. It kind of changed our relationship a little bit.
The company tried to hush it. You know, it's not the problem. Now they kind of, if it's happening and you come, they'll do something about it. But they're not going to educate you on this.
Representatives of the grocery chains where Jean and Anita work declined to talk to us. But the Food Marketing Institute, a grocery industry trade group, doesn't feel RSI is a significant factor.
Our feeling from the initial look so far is that it's not widespread in the industry, and it's apparently a condition that not everyone develops. There are people that appear to be predisposed to repetitive motion injury, others that can do the same kind of activity and never develop symptoms.
Union officials, however, believe the problem qualifies as a national emergency. In 1991, 30 unions petitioned the U.S. Labor Department to issue an emergency training standard to contain the exploding injury rate.
And the Labor Department of our government took it under advisement and just came out, I think this last month, and denied the appeal for this emergency standard to be established. And in essence, they're saying, well, gee, the problem doesn't exist at that kind of a level.
In the absence of a response from industry or the national government, many labor representatives are turning to regulatory agencies. California has seen more debate around repetitive motion hazards than any other state. And the state OSHA program has been holding public hearings on a proposal that would mandate training for workers at risk for RSI and also make immediate medical and worksite evaluation available for injured workers. Len Welsh is an attorney with the California Division of Occupational Safety and Health.
The primary benefit that would come out of this would be that workers would recognize that they're not supposed to hurt when they do their work, that there should be something available to make it so that their work activity is not painful.
It's going to cost you both a lot less than if you wait until the employee goes to the doctor and has an advanced case of carpal tunnel syndrome.
For large employers as well as for small employers, there's going to be a lot of opposition to this.
And what we're concerned with is that employers are not going to be given necessary flexibility to deal with individual problems.
Industry representatives, however, have strongly opposed California OSHA's effort to set ergonomic safety standards.
I think the current proposal is far too broad. It places too great of a burden on California employers. When labor comes to the table, labor is not looking at the bottom line for the employer. They're looking at what is the Cadillac in terms of safety and prevention for the employee. And so Cal OSHA has had to act as the intermediary and try to find the middle ground, and we think they haven't found a middle ground.
Labor representatives expressed surprise at the extent of the business community's opposition to proposals aimed at reducing the risk of RSI.
Of all the issues I've ever dealt with in health and safety, I've never seen such incredible employer resistance as in this issue. And I don't know why that is, except that 2/3 of the people I represent will be affected by this. And that terrifies employers.
When we got into this, we weren't thinking about all of the ramifications in terms of how business was going to feel. We just thought that this was the right thing, and we thought that whoever pointed it out first would get the support of the other. And so, you know, to that extent, I guess I was naive. I didn't think that we were going to have to roll up our sleeves and go to war.
While the war wages, injured workers find themselves struggling with limited options. Anita, who was on disability leave for nearly a year, is now back at work and taking care not to get re-injured.
You know, the doctor explained to me what was happening to me when I finally had to have surgery, is that my tendon pulled away from my elbow. He described it like a chicken leg, you know, the bend in the chicken leg, and you know that gristle in there that keeps, you know, the bend. If you cut that gristle away, then that's what happened to my arm. And I'm very cautious now. My height I found to be played a part in my injury because I'm a little short and the registers are a little high and things are not in right reach. And I started putting 2 mats down, and that kind of elevated me a little bit. That helped. And then I just slowed down a little bit, and I said, I don't care about the productivity.
Jean, however, has been less fortunate.
It's changed, you know, my role in the family, and it's kind of made me feel like, you know, I'm not as important as I was before because I like being the provider of the family. The industry as a whole, the grocery industry as a whole, should come up with some type of answer that might assist people in keeping from these injuries. I don't know if it's because of my injury, but I've been reading a lot more about how the costs are skyrocketing. And I think that in itself is going to be a motivation for Lucky's and the grocery industry to start changing their the way they handle this problem.
One of the industries that's seen the sharpest rise in injury rates is also responsible for keeping us informed about workplace hazards, daily newspapers. Sherry Graves is a reporter and editor with the Santa Rosa Press-Democrat.
Yeah, I think about the only thing I haven't done is sports. I spent 10 years on the copy desk.
Sherry started working for the Press-Democrat when she was 18. Now, after 29 years in the newspaper business, her career as a journalist may be over.
I have carpal tunnel syndrome bilateral, affecting both hands. I had surgery on both hands. Then I also have chronic tendinitis and tenosynovitis, which creates a kind of like a toothache sort of feeling from my fingertips all the way to my neck. on both arms. One of the first things to go was my independence, because it got to the point where I couldn't drive. I couldn't cook anymore. I couldn't clean house anymore. Even now, I can't get into and out of a bra without help.
Since her surgery nearly a year ago, Sherry has been struggling to find a resolution to her RSI case, battling her employer, the workers' compensation system, and the manufacturer of the computer that caused her injury.
It just takes your dignity away when you can't take care of yourself, and when you are used to being fully in charge of your life. It's almost like having a death in the family. I've lost who I was. And I don't know who I am anymore.
After her surgery, feeling she had to take control of her life, Sherry enrolled at her local junior college. Meanwhile, her colleagues back at the Press Democrat struggled to deal with the continuing high injury rate in the newsroom. Miriam Silver and Susan Swartz are Press Democrat writers who have been involved in efforts to get the newspaper's management to address the issue.
And I think that they had some problems understanding how bad it was. I think when we finally came up with the numbers, they were as shocked as we were.
And when some key editors came down with it, with some of their people came down with RSI, it made a big difference. It wasn't just a complaint among the workers.
I don't think you can solve the problems created by RSI without a commitment from everybody involved.
Bruce Keyes is the Press Democrat's executive editor.
Without the commitment of the employee, they're not going to take the preventative measures. Without the commitment of the management and the managers, they're not going to watch out after the employees on a day-to-day basis. And without the commitment of the company, you're not going to get the proper equipment, the proper education, the proper medical treatment.
Only a few newspapers, most prominent among them the Los Angeles Times, have developed comprehensive programs to address growing rates of RSI. Staff members say such efforts can make an enormous difference, both in reducing injuries and improving staff morale. In the last year, some effort in that direction has been made at the Press Democrat.
I think with the new keyboards and the new furniture and the system, I hope that we're lessening the risk. We are certainly not making it go away.
But none of this has helped Sherry, who started to see a job rehabilitation counselor several months ago.
The first thing and the main thing we've really been looking into is trying to get her back with her previous employer. And that's a question of, do they have jobs that don't use the wrists? And I have medical reports that indicate she shouldn't be typing for more than an hour at a time.
When I push it farther than that, that's when I begin ending up with problems, when I try to do that.
In fact, she recently applied for another position there, but the typing was too much, so she couldn't do it.
Clearly, this is probably why they don't want me back. I've charged them with serious and willful misconduct because they knew about the risk. They didn't warn me about the risk. They didn't protect me from the risk. And look what happened to my life. I lost my career. I lost my independence. I lost my self-esteem. I lost my home. I couldn't make my mortgage payments on these stupid, piddling little worker comp benefits that I was getting. I couldn't even support my kids on that. Where's my employer's responsibility in all of this? And where's the responsibility for the makers of the computer?
Along with several dozen other people suffering from severe cases of RSI, Sherry has filed suit against the manufacturer of the computer that caused her injury. Her attorney, Stephen Kazin, believes such lawsuits may force manufacturers to produce safer equipment.
The concept of product liability is really an extension originally of the basic idea of negligence, which is that if you do something careless and you hurt somebody, you ought to pay the bill for what you did. It's a way to get the manufacturers to recall the product, to redesign them, to protect other people, so that we kind of cut short this cycle of repetitive strain injuries, people getting hurt, going off work, coming back to the same job, getting hurt again.
We contacted several defendants in product liability suits, including IBM, Apple, and Hewlett-Packard, but all of them refused to be interviewed for this program. Even if product liability suits eventually succeed, which some legal experts question, plaintiffs like Sherry won't see compensation for years. In the meantime, despite the increasing awareness of RSI, growth in the repetitive injury rate is far from over. Samantha Greenberg is the founder of the Computer Injury Network in Los Angeles.
I think with all the downsizing that's going on in companies, you know, the people that are left behind to work are working twice as hard and twice as fast. So I personally am seeing more of it. You would think that you wouldn't see as much because employers are hopefully becoming aware, but I'm getting more calls than the norm. And a lot more people are working injured.
I can't predict the future. I don't know. Maybe they'll come up with some real easy solution or keyboard, and there's some magic out there that, you know, some vaccine, I mean, that will solve the problem. I can't predict it. I hope something's figured out because it's become something of a scourge in the industry.
Sometimes I wake up in the night and I'm crying. I'm scared to death. I don't know how I'm going to pay next month's rent in this house. Where's the end of this tunnel? How long does this go on?
Hi. The film you've just seen, Working Until It Hurts, has been produced by a California group called We Do the Work and is described in rather graphic and painful detail job injuries suffered by a lot of American workers. We're here this evening to discuss that film and its implications in the state of Maine. I'm joined on my right by Ned McCann from the Maine AFL-CIO, and on my left by Vinny O'Malley, the Executive Director of the Maine Labor Group on Health. Gentlemen, welcome to the show. We are here tonight. I think it's significant. This is being shown, at least initially, on April 28th. April 28th is Workers' Memorial Day. Ned and Vinny are both wearing little stickers that indicate Workers' Memorial Day. The flyer on the front of the table talks about Fight for the Living, Workers' Memorial Day, April 28th. And it may just be that not all our viewers know what we're talking about. And maybe we ought to start, Ned, with you. Could you explain to our viewers what is Workers' Memorial Day?
Sure, Mike. Workers' Memorial Day is a day that's set aside once a year by labor to remember and to honor those who've died in the workplace in the United States. April 28th is the day selected for the remembrance of workers who die on the job, because it is the day that the original OSHA legislation was passed in 1970, I believe. Is that right?
Okay, so it's a day of some significance, not just here in Maine, but nationally for labor.
That's correct.
And Vinny, your organization has been involved with Workers' Memorial Day, and I wonder if you may first describe a little bit what is the Maine Labor Group on Health?
The Maine Labor Group on Health is referred to as an occupational health and safety organization. You may have heard the term COSH's, Committee on Occupational Safety and Health. That's what you could describe us as, although that is not in our name. COSH's were started in this country about 20 years ago. The first one was out in Chicago called K-COSH. And what happened was members of labor, health educators, health professionals organized around health and safety conditions of workers across the country. This organization, Maine Labor Group on Health, was formed in 1977. We just celebrated our 15th anniversary last year. We were formed with members of the Paper Workers Union, the Machinist Union, health educators, nurses, and what we do is our mission statement is to educate Maine's working people about the health and safety in the state of Maine.
All right. Well, health and safety in the Maine workplace is an issue that affects all workers. And I would suggest, I think the film was interesting because it didn't look just at your sort of traditional view of a industrial worker, a construction laborer, or someone who might work in the woods, who people consider those to be dangerous occupations. But this film talked about a newspaper editor and somebody worked in a retail store. People who had more jobs that one wouldn't consider to be dangerous occupations, and yet there seems to be a rather high incidence of work injury in those occupations. And Ned, I wonder if you could talk for a minute about what you're familiar with. What's the Maine AFL-CIO see in terms of job injuries in the state of Maine?
In the state of Maine, we still have the highest rate of injuries of any state in the nation. There are a number of reasons for that, but the facts are there. We've seen a shift in the nature of work and the nature of our economy over the last several years, actually the last couple of decades. This has, not been accompanied by a shift in the rates of injury in the workplace. In fact, in some occupations, workplace injuries continue to increase. The film that we saw tonight focused a lot on carpal tunnel syndrome, and with the increased use of video display terminals and telecommunications, we're seeing an increase in the rate of injury on the job associated with that type of work. In fact, I believe that carpal tunnel or repetitive stress syndrome is the fastest increasing category of workers' compensation claims in the state of Maine, and have a lot to do with the high cost of workers' comp in the state of Maine.
I think that it's probably safe to say that most people in the state of Maine hear a lot about workers' compensation and the crisis in workers' compensation, and it's generally thought of in terms of a cost issue, and clearly it is a major cost issue for businesses and for workers, but what workers' compensation is really reflecting is work injuries and people being injured and in severe cases killed on the job. And Vinny, I know your organization has done a lot of work in terms of looking at the statistics in Maine, what kinds of injuries, where they occur, who's subject to being hurt, and I wonder if you could talk for a little bit about that. Who's getting hurt in Maine, and why are they getting hurt? And then we'll talk about what's being done about it.
Well, I think that you can answer that. It's not an easy question to answer. The accident injury rate for 1991, which is the latest statistics from the Bureau of Labor Standards, which is, by the way, a state of Maine a bureau in the state of Maine that does a wonderful job of compiling these statistics each year. And although the rate for 1991 has decreased somewhat, gone down 10 to 15%, we're still 40% above the national rate, the standard rate, industry rate for the rest of the United States. The state of Maine injury rate is 40% above that.
Now, does that mean overall injuries?
That means overall injuries. Of course, there's a lot of problems with workplace reporting, with people not, some industries aren't even covered. The fishing industry doesn't cover when they talk about workplace fatalities. Agriculture is not covered. People who work a lot of times off the books don't. Those jobs, those injuries aren't recorded. One-person outfits, people self-employed. A lot of times they don't show up. So I believe that that statistics really only represent it would be higher, actually, that the statistics. Who gets hurt? I've heard a couple of people comment that one of the reasons that the possibility that the rate went down was because of the recession that we've lost, and we've lost a lot of our jobs, as Ned has referred to, in traditional blue-collar, heavy industries have really cut back in the state, as they have across the country, for a variety of reasons. So a lot of the injuries you're starting to see, these repetitive motion injuries, carpal tunnel, whatever you may call them, you see them in a lot of the retail stores now. Clerks, I mean, that's one that makes up a big, retail is one of the industries that went up in 1991. The statistics went up for injuries, incident rates. Fatalities is another thing. There are a couple of studies underway, and the 1991 study is not finished yet, but we had over 50 fatalities in the state of Maine in 1991, and we had nearly 60 in 1990. Those are abysmal statistics, no matter which way you look at them.
Yeah, so I think it's important to point out, Ned, you mentioned at the outset that Workers' Memorial Day is a day that we devote to focusing and remembering workers who have been killed on the job, and there are incredible numbers of people killed on the job every day in this country. But it's also a day that labor is not just remembering, but also trying to organize among those people who've been injured on the job, because there are, statistics escape me at the moment, but there are hundreds of thousands of workers who are injured on the job, from repetitive motion injuries, as we've seen in the film, to very severe traumatic kinds of injuries. And we're looking at, as far as labor is concerned, we're looking at ways that we can turn around what has been a rather appalling increase in the number of work injuries, to try to do some things to turn that around and begin to bring health and safety awareness and improved health and safety conditions to the work site. And I think there's a number of things we can talk about there, but maybe, Ned, would you perhaps start with what are we looking to do in terms of the law, and explain again for our viewers who might not know that there is a law on the books, what it is, and what are we trying to do about it?
Okay. The law I referred to earlier, OSHA, Occupational Safety and Health Act, was passed in 1970 to cover occupational health and safety. And OSHA has done some wonderful things over the years, and business people often complain about the complexity of the rules, but what it's designed to do is to protect workers on the job from being killed and from being injured on the job. It's very important, obviously, from our perspective, to protect the health and safety of working people. It's a devastating thing to have somebody get injured on the job, to lose their livelihood, to become often impoverished, and people lose their identity. A lot of their identity, a person's identity, is tied up in their job and their work and what they do. So it's very important to us. It's very important to the overall economy as well, that we improve safety and health in the workplace. It really has a dramatic impact on productivity rates in this country. There are a couple things that we're working on. The AFL-CIO and its member unions are currently working on OSHA reform before the United States Congress. In fact, there's a bill that's coming up that's fairly comprehensive legislation that would do a number of things to improve health and safety for employers and for employees on the job, including creating joint health and safety committees on the job, some better training for workers, increased enforcement, and giving workers the right to refuse obviously dangerous assignments without worrying about losing their jobs.
Well, let me ask you to focus, and Vinny also, if you would comment on this, the issue of joint health and safety committees. That was a big focus of what was discussed this morning at the State House, and again at our Workers' Memorial Day event there, where we met with a number of state legislators and business and labor people as well. And we spent a lot of time talking about the importance of joint labor management safety committees in the work site. Why is that so important? Why are we looking in a piece of legislation? Why are we trying to get Congress to pass a law that says companies are going to have joint labor management health and safety committees?
I think there are a couple of reasons. I think, as you both know, and who both served, we all served together on a labor management group this summer. Actually, it lasted all year, the workers' comp group. And that was one of the issues that we discussed, was the input of workers into the workplace. I mean, who better knows the job stresses or the injuries that occur on work sites except the people who work there. We thought, from our point of view in that commission, that was one of the most important pieces of the thing, was that there be involvement by employees. This OSHA reform would call for joint health and safety committees, whether they're a union shop or non-union shop, that there would be an input from workers about health and safety. You know, I think that one of the buzzwords in business and industry these days is, TQM, is total quality, and what that basically really talks about is involving workers in more in the decisions that are being made, and what decision is more important than the decision that affects your health and safety. One of the other things we didn't talk about much is occupational injuries, illnesses. That's again something that has been is not discussed. It's kind of difficult to discuss in polite circles, but I mean, we talk about some of the incident rates of occupational illnesses, and asbestosis and the cancers and the respiratory ailments. Those just don't show up very well in statistics, and that's something that we know over the years workers have paid for with their lives for time and time again. So I think the OSHA reform bill is an important step in starting to get workers involved in whatever level and what other organization. Any shop that would have 11 employees or more would be mandated to have a health and safety committee. If it was a union shop, it would be involved with obviously a shop steward. If not, it would just be there would be some mechanism involved to have some sort of input.
Yeah. I think this is a real important point, because I know from my own experience of dealing with workers in some of our shops, the textile and clothing plants in the state, that you see a lot of instances where managers and engineers design workstations, or they design a process that they think is going to improve the production flow, or somehow get product out the door. And I mean, it's amazing, but it's true. I mean, they just don't often think of talking to the workers on the job to ask them how to do it, because after all, if we have to ask them how to do it, then why do they need me, right? The engineer. I think there may be some of that goes on, but I mean, I've come across situations, and I won't mention names of any companies here, but a rather large employer in Maine, where there have been a lot of time and money invested in changing the production process, and nobody apparently talked to the workers involved, because once the new design came out onto the shop floor, it was obvious that it was ill-designed for workers who now had to bend, stretch, and who within weeks had complaints filed about developing back injuries, back pain, and so on, and that register. That means big numbers to those people who workers' comp liability. They get very concerned when they start hearing people complain about back injuries, and it stems from just a lack of communication. I don't believe that employers are out intentionally to hurt workers. I don't think any right-minded employer is trying to hurt anybody. But they're trying to accomplish a task without oftentimes thinking about or talking to the workers who are going to be involved and have to do that work. And I believe, from my own personal experience, that joint labor management committees that can really deal with these issues and talk about them without fear of reprisal or fear that somebody's going to lose their job because they question the boss, which you can do in a union environment. In a non-union setting, good luck to you, because you don't have a protection of a union contract, and you can be down the road. But I think that, to me, that's a real key element in this legislation, is requiring that, putting the force of law behind a joint labor management project.
it's a shame that we have to do that. I mean, it would be nice if we didn't have to mandate it, but the numbers are alarming, and this is really important. And it's especially important for non-union employees who have no mechanism, no avenue to deal with this whatsoever. So that's why, it's important that it is included in the legislation.
Yeah.
And again, it's a shame that it has to be, but we think it is.
Yeah, I think I think a good case can be made for the car that Ned drives. Ned drives a Saturn, and which is built the Union plant in Tennessee or Kentucky.
Spring Hill, Tennessee.
Spring Hill, Tennessee, and it's really one of the success stories. But basically, one of the things that they encouraged there was worker involvement in everything, from the design of, not just the design of the car, but from the design of the shop floor where you make the car. A lot of times, I think unfairly in this country, workers have been backhanded for decisions that have been made completely off the shop floor. Decisions that were made in engineering or by MBAs or by looking at the profit line here and design products that just didn't work. And it wasn't a lot of cases workers' fault. I think it was the design or their involvement was not in there. I think the Saturn is a classic example of something that was done jointly, joint labor management, and has been a huge success.
I think you're right. There's an excellent book that I would recommend to our viewers called Negotiating the Future, written by Barry and Irving Bluestone, that describes in detail the Saturn project that developed the Saturn automobiles, but really relies on this system of saying that workers are important. They are a very important element of any business, and that workers have brains. They're not just muscle and bone, but there are people who know how to do things and whose creative talents can be tapped. And I think that's sort of what's behind the idea here in our OSHA reform legislation, is that we oughtn't be in the traditional adversarial relationship between labor and management, and we're on opposite sides of an issue. This is an issue where labor and management should have the same interests. And Ned, let me ask you, you made reference, or Vinny, you made reference to the labor management group that we were involved with last year. Without getting into the details of that group, maybe you could talk a little bit about what that philosophy is and how you think that fits into health and safety.
I think, for starters, that you hit it on the head already, which is that we have shared interests. We have labor and management have a shared interest in a healthy economy. They have a shared interest in healthy workers. It's obvious from my point of view as a workers' representative that I want to have people healthy on the job. I want them to be able to take care of themselves and to retire and to lead a nice life. But it's also important for the employers in terms of their productivity, and in terms of long-term profits, in terms of the costs of training and retraining workers. If we continue to have people injured on the job, then the health care costs continue to go up. That's not in the employer's interest. That's not in the employee's interest. The interests of labor and the interests of management obviously are not the same, but we have many shared areas of interest and need to work together on them, and I think this is one of them.
Vinny, let me ask you to turn for a minute to the Maine Labor Group on Health's experience in your efforts to have kind of cooperative ventures is the right way to describe this, but how do you find employers reacting to the work of your organization? What's their view generally?
Well, one of the we do an awful lot of training in the fields of asbestos workers, hazardous waste workers. That would be workers who work on a Superfund site, on a hazardous waste site, and need a 40-hour course. That would be asbestos workers who do the abatement in the abatement industry. And we have a very good rapport with the folks that we do the training for industry, because they understand that a well-trained employee is going to work better for them, is going to work more efficiently for them, is not going to cause, because there's an awful lot, especially now, there's an awful lot of chemicals, there's an awful lot of dangerous and hazardous conditions out there, especially around the two industries that I mentioned, the asbestos industry and the Superfund, hazardous waste industry. And if you don't have somebody well-trained, well-versed in basic health and safety, then you're going to have a problem on your hands. Or by exposing either workers or possibly exposing a whole community or others to very toxic, which could be very critical results.
Well, I'd like to, in the little time that we have remaining, just talk for just a minute about the legislature, because here in Maine there's been a great deal of attention paid to reforming and overhauling the workers' compensation system, and I don't mean to get into that. That's a show in and of itself. But what are the things, now that the workers' compensation, quote, reform package has been passed, implemented, the new laws in effect, what do you see organized labor and the trade union movement doing here in the state to try to improve the health and safety conditions, not just of union workers, but of all workers throughout the state? What are the things that labor is going to do?
I think there are a couple things that that are immediately before the state legislature that we can do and that we are working on. One is that Vinny touched upon earlier, which is to include occupational illness as being covered under the Workers' Compact. You see some very alarming stats in the Oxford County area and Milltown areas of some strange types of occupational diseases. Long-term diseases often don't show up until later in somebody's career. Also, we're working on legislation that would address some of the problems that we saw in the movie earlier this evening, and that is video display terminal protection for people who work on the terminals. And so those things are coming up that are being dealt with now for the short run. For the long run, we need to continue to improve occupational safety and health in the workplace, the workplaces we represent, and through the legislative arena.
Okay. Well, I think that what we are going to be facing is labor speaking out for improved health and safety conditions in the job. And what we saw in tonight's film is not unique to California where the film was made. You see things like that every day in the state of Maine, all across all of the industries here in the state. It seems to me that our job in labor, through the AFL-CIO, through the Maine Labor Group on health, through the different unions, is to raise awareness of health and safety conditions and to press for them to be resolved. And Vinny, I wonder if you have
I just think that we ought to tell folks about maybe a little bit about this series of films, and that they are being shown on other public broadcasting systems throughout the country. The Maine Broadcasting has not chosen right yet to show these films. We think they're very important, and we certainly hope that people get access to these videos, and because it is a series.
Right, that's correct. The series, the film you saw tonight is from We Do the Work. And there's a whole series of films that deal with contemporary issues from the point of view of workers. And I would suggest that most people who are out watching this show are workers, whether you're an academic worker, a white-collar worker, blue-collar worker, pink-collar worker, or an unemployed or underemployed worker. We don't believe that your concerns are getting adequate attention and representation in the traditional media. So we welcome opportunities like this one to get our message out, and would encourage people to demand access to shows like the We Do the Work series on labor-related issues.
Don't miss Cav's Corner.
And don't miss the Cavanaugh's Corner. Thank you very much. I think we're through for this evening.
Thanks for having us, Mike.
Sure. Thank you. Okay. And we just need to continue.